External beam radiotherapy uses high-energy X-rays aimed at the site of the cancer to destroy any malignant cells. It's suitable for men with cancer that is confined to the prostate or locally advanced disease where the cancer is confined to the pelvis. Candidates must have no significant lower bowel disorder and no previous external beam radiotherapy to the pelvis. Hamish Marriott Crosby is a radio journalist who had radiotherapy as part of a combined therapy to treat an aggressive prostate cancer.
The diagnosis came after I'd spent too long getting up at night to go for a pee, and my wife suggested that I should go to the doctor. And then, behold, I had a PSA of 53, and alarm bells started ringing all around the local medical profession. It came as a huge shock because other people win lotteries, don't they? And why should I get cancer?
Hamish had a mixed treatment of high-dose brachytherapy, hormone treatment and radiotherapy.
Radiotherapy was my preferred option because I thought my innocence it was the least invasive, and all I would have to do would be to go in and lie down and have a machine point at me, and I'd go away and come back the next day. There's an element of truth in that, but there's more to it.
Before candidates have radiotherapy, they usually have a hormone treatment to suppress testosterone. This effectively shrinks the prostate so smaller beams of X-rays can be given.
You have to consider that the hormone treatment, which will reduce your libido, will have an effect on your life short term, so you must talk it through with your partner. It will change your character to a certain degree. You will become slightly more aware of what's going on, you will become slightly less aggressive. I used to get terrible hot sweats, which brought me no sympathy at all from any woman over 50. It made me very weepy, and I discovered that when I was reading an Oscar Wilde short story to my granddaughter, and I found myself crying. But it did have the effect of shrinking the cancer.
External beam radiotherapy for local and locally advanced prostate cancer is usually given as a 10-minute treatment every day, Monday to Friday, for between 5 and 7 weeks.
Well, here we are. It's the original one-size-fits-all bed. The place where you put your feet, the support for the knees are movable, and on your notes they will know exactly where to place these two critical points.
From around the second week of treatment until a few weeks after treatment finishes, men experience predictable and treatable side effects, including tiredness and disturbance to urination and bowel movement.
I had problems of suddenly, desperately needing to have a pee, and I became very aware of where every public toilet was. It is daunting. The first picture of it is daunting. You think, what on earth is that? And then you realize it's all going to move and turn around you. But the bed comes up and it moves backwards this way until your prostate is exactly centered under this little gun just here. It then says exactly where you are in relation to some fixed points on lasers. They line you up. It's easy. There's no problem. It just goes round, takes a shot at you, comes the other way, takes a shot, and you walk away and you go on to your normal day's life, whatever it happens to be. The worst thing is it's boring. The good thing is it doesn't hurt, it's quick, it's painless, and you're in and out.
Long-term side effects begin any time between 6 months and 2 years after treatment. 2 in 5 men will experience some erectile dysfunction, and 1 in 5 will experience bowel disturbance. A slight bleeding from bowel or bladder is also normal, but is always investigated to rule out any other issues.
I did experience erectile dysfunction. It was a temporary thing though, and it came back gradually in the normal process of things after the event, a few months perhaps.
Clinical oncologist Heather Payne at London's University College Hospital is Hamish's consultant. Heather specialises in treating prostate cancer.
Radiotherapy involves X-ray treatment. They're high energy X-rays, but patients aren't radioactive. The treatment is given with a machine called a linear accelerator, which you can see behind us and is causing a nice humming noise at the moment. These machines deliver X-rays which pass through the patient. It's a completely painless therapy. You don't feel anything at all. When you treat the prostate, the hair on your head doesn't come out, it doesn't burn your skin, and it doesn't make you sick. Whereas other areas of the body, you may get those side effects. But I think it's really important that those myths don't put people off from having treatment. Radiotherapy can be a good alternative for surgery for those men who aren't fit for an anaesthetic, for those men who would prefer not to have a surgical approach, and for early disease the cure rates are very similar.
Radiotherapy combined with hormone treatment is standard treatment for locally advanced and high-risk disease. Hormones are taken for 2 or 3 years after radiotherapy because it's possible that tiny cells which are too small to be seen on any X-ray or scan could have escaped at the beginning. Hormone treatment helps stop them developing.
So these combined treatments have been shown to increase the cure rate for locally advanced prostate cancer and have been shown to dramatically reduce the chance of it coming back in other parts of the body. And this has been a great step forward, and I think one that gives many hope to men with slightly more aggressive prostate cancer. Going back to when you first presented, the cancer had spread outside of the prostate, although thankfully hadn't gone to any distant sites such as the bones, but there were cells in the lymph nodes and it was quite aggressive within the prostate itself. So I think we did have challenges, and you've done brilliantly well with all the treatment.
I think on the whole I was rather lucky because I had side effects, but nothing which could be classed really greater than an inconvenience.
How are you now?
I'm feeling wonderful, and
Brilliant.
I hope it's the result of these figures which I've got. These are my last tests.
Thank you. Have you looked at them?
I sort of had a look, and I think I'm quite positive about your reaction.
Oh, that's brilliant. That's really good. PSA 0.05. Now, what is the excellent news is that your testosterone has come up to almost normal limits,
Yeah.
which is brilliant.
Hormone treatment suppresses testosterone, so the PSA level drops to 0. Once a man comes off hormone treatment, testosterone returns and the normal prostate starts making PSA again, and the PSA level generally rises.
Because after radiotherapy with a normal testosterone, the PSA can be 2.
Yeah.
And at 0.05, that's brilliant. Of course, the other thing that happens when the testosterone recovers is that the side effects of the hormones improve.
Yeah.
Have you noticed any changes?
I'm not having the hot sweats now. I'm not getting terribly weepy about silly things. Yeah, and the libido is back, and it's come back. So things are looking good, really. I'm really rather pleased with myself.
I'm absolutely delighted. That is brilliant. Everything's in remission, and we can leave it for 6 months. I couldn't be happier.
I'm now 2 years away from radiotherapy, and above all, I feel lucky. I also feel pretty normal. I'm still aware that I might go to the loo a bit more than other people, but that's nothing. I mean, what's that in life? It's nothing.